Hey guys, my name is Zuri, and I'm doing pretty good this evening. I still have a lot of homework to do, but that's life. You just have to take it one day at a time. And before we get this video started, I just would like to say a big thank you to Ethan for inviting me to do this interview with him. I think it's just a really great way to learn about new topics and to grow and learn new things. So again, thank you, Ethan, for inviting me to do this interview with you. I can't wait to see what you do in the future, and I'm just really happy that we're getting to know each other. And again, my name is Zuri, and one fun fact about me is I'm an equestrian, and for those of you who does not know what that is, an equestrian is basically a person who rides horses competitively. As you can see, some of my ribbons, so I ride horses competitively, which means I go to shows and then I get judged and then I get ribbons. But apart from being an equestrian, I'm also an advocate, especially for BIPOCs in the horse world. So I'm really advocating for that. I'm speaking out for the achievements in the horse world for people of color. And apart from riding horses in the future, I want to be able to own and operate my own equine therapy facility, which leads us to the topic of mental health. Now, for me personally, mental health is something that's very, very important for me, because it's the field that I'm specifically going in college to study for. I want to be a therapist, and mental health is very important, especially in today's society, because as we can see, a lot of youth, a lot of young teenagers were dealing with different stressors such as school, work, and just social media, to different stressors that can cause people to have mental illnesses and things of that sort. And I feel like mental health is especially important, and it's an important topic to talk about because it's not really talked about. And the only way that things are going to get better, and the only way that we can improve, especially for those who have mental illnesses or are struggling with things, is to talk about it. We can't go anywhere if we don't talk about it, and making it normalized. It's okay not to be okay. Not every day is gonna be perfect, and you gotta remember, people are going through different things. People are affected by things differently, and just remember, it's okay to be okay. And just, if the last thing I say, just check up on your friends and family, because you just never know what they're going through. Now, I say this all to say that mental health is not just a vacuum. Mental health is affected by every aspect, from everything we do and everything we don't do. Even the most smallest thing can affect it. It is sad because we live in a world where having good mental health is not promoted. We live in a world where it's promoted to work. But where's the time to rest? The world creates this problem, but then the world or society does not want to address the problem it created. If you can take away one thing from this video, it would be, it's okay not to be okay, and it's okay to step away from work or school to just take a me day and focus on yourself. And it's okay to take breaks. Remember, please, I am begging you to take care of yourself, especially during these unprecedented times. At the end of the day, you are the only person who can take care of yourself, and you have to live with yourself for the rest of your life, and only you know what's best for you. Thank you. And mental health is also very important because there are many people my age, young adults, who are struggling with mental health. And we need to talk about it. It's important because we live in society where there's many different issues, not just mental health. There's other issues, but those are topics for another day. And people are just struggling with it. And we want to live in a world where society tries to put this picture of everything's perfect. We want to have a utopian society, right? We want to have a perfect world. The world we live in, the society we live in, it does not want to address any issues that are negative. When life is not all butterflies and rainbows, there's ups and downs, there's trials, there's trials people have to go through, and that's just, life is not perfect. And in society, we want to stress having a utopian, perfect world, cookie cutter, perfect, everything's happy. Like, mental health is such a taboo, and it's very important to especially talk about it so it does not become a taboo anymore. And we want to live in a utopian society, a utopian world. The only way for that to happen is if we address the issues and problems that we're facing in the world. Like, we want to have a utopian society, but we're far from it. And the only way for us to have a utopian society, or get quote unquote the perfect world, is to talk about these issues, talk about the struggles people are facing, and to talk about mental health especially, because so many people are dealing with it, and it's hard for them to seek help in a world that doesn't want to hear them out. I have switched my locations, but that's besides the point. But I will continue what I was saying before. I was saying that there are mental health affects every aspect of our lives, and even the smallest things that we do, we don't think about how it's negatively impacting our mental health. Now I want to stop and take a brief minute to define mental health, because mental health often gets confused with mental illness, and you can have bad mental health without having a mental illness. Now, mental health is defined as your state of emotional well-being. And mental illnesses are diseases that causes mild to severe disturbances in thinking, perception, and behavior. So you can have bad mental health but not have a mental illness. Now, going back to how I said mental health affects every aspect of our lives, some of the things that we do, I'm going to focus on 3 affect our mental health, and we're not really realizing it. The first one is sleep. People my age and teenagers and young adults and even full-on adults, they don't get adequate sleep. They don't get enough sleep due to school, work, whatever it may be, whatever the cause may be, which leads to sleep deprivation. And sleep deprivation can cause many sleep disorders themselves, or it can worsen symptoms for people who already have mental illnesses. And the second one is exercise. As a generation, we do not get enough exercise, or we do not get any exercise at all. We are supposed to get 60 minutes of exercise every day, or 30 minutes of exercise 3 days out of the week. Exercising correlates to mental health because it's a natural way to release stress from work, school, or whatever the cause may be, or reason may be for the stress. And when we exercise, the brain actually releases neurotransmitters such as endorphins, dopamine, serotonin, and many more transmitters. And those transmitters makes us feel good, which improves our mood. And exercise can help us sleep better, which I said earlier is another factor that can affect mental health. So you can now see how every mental health is affected by every aspect of our life. And it's all connected. And exercise also helps sharpen your memory, it makes you more relaxed, and be more positive about yourself and your life. And now what I find crazy, well rather interesting, is that exercising is just as effective as antidepressants for treating mild to moderate depression, and also provides great help for people who are suffering from anxiety and ADHD as well. The last of the three things I'm going to talk to you guys about is social media. We use it every day and we are practically glued to our screen. But have you ever stopped and wondered just how exactly it affects us? We spend hours and hours scrolling through Instagram posts, watching videos, or whatever the case may be. And I'm guilty of that too as well. Social media is impacting our mental health. And sometimes we don't even realize that. On average, people from the ages of 16 to 24 spend about, on average, 3 hours and 1 minute using social media each day, according to a 2018 report issued by Global Web Index. And another research report done by a journal called JAMA Psychiatry found out that adolescents who use social media more than 3 hours a day may be at a heightened risk of mental health problems, particularly internalizing problems. So, for example, did you know that for girls who use social media such as Instagram or photo-based social media, they have a higher chance of having a lower self-esteem, and lower self-esteem could possibly lead to depression, anxiety, eating disorders, and etc. And social media can also further damage to people who are suffering from mental illness, or social media can cause it. Social media can also cause another issue, FOMO, or fear of missing out. And 20% of people have FOMO. And the 20% usually has at least one social media account, and they feel that they have to check their social medias like once every 3 hours or so to avoid anxiety or feeling anxious. No, I'm not saying that to go quit social media or social media is bad, because it's not. It's just like everything else. Anything in moderation is good. Just remember to take breaks and try not to spend your entire day on social media, and to do something else.